Hello friends, today we will start a series of summary of Irish guidelines of gynae and obs. Now today we will discuss the Irish guideline number 1, which is ultrasound diagnosis of early pregnancy miscarriage. First trimester is up till 13 weeks of pregnancy. Commonest complication of pregnancies: spontaneous miscarriage. Pregnancy loss less than 24 weeks is termed as miscarriage. First ultrasound evidence of pregnancy is gestational sac, which is first identified at 4 plus 2 weeks when the size is 2 to 3 mm. First structure seen with the gestational sac is the yolk sac, which is seen by TVS when the mean sac diameter is more than 5 millimeters, and it should always be present when the mean sac diameter is more than 7 mm. The embryo is seen by TVS if it is 1 to 2 mm in length. Cardiac activity is seen when the embryo is 5 millimeters. Now, how to commute for age of gestation using crown rump length. Age of gestation is equal to crown rump length in centimeter plus 6.5 weeks. Example, CRL is 30 mm plus 6.5 weeks, which is equal to 9.5 week of age of gestation. Now there is a chart of age of gestation, anatomical landmark and comments. At 4 weeks plus 2 days, gestational sac is 2 to 3 mm. 10 to 20% of ectopic has pseudo-gestational sac. At 5 weeks, yolk sac is equal to mean sac diameter is 5 mm. If yolk sac is more than 10 mm, then it shows poor prognosis. At 6 weeks, embryo is 2 to 3 mm. When mean sac diameter is 10 mm, confirm the intrauterine pregnancy. At 7 weeks, MST is 20 mm. Head and trunk, if no yolk sac or embryo, then it shows poor prognosis. At 8 weeks, MST is 25 mm. Head size is equal to yolk sac and midgut herniation. At 9 weeks, choroid plexus, spine and limbs. At 10 weeks, cardiac chambers are formed. At 11 weeks, gut returning and most structures are identified. Now the ultrasound determination of pregnancy loss by TVS. If mean sac diameter is less than 20 mm and there is no yolk sac and no embryo, or fetal pole is 8 less than 8 mm, then fetal heart rate for 30 seconds. Now pregnancy of uncertain viability is this. Then repeat the ultrasound after 7 to 10 days. By TVS, if the mean sac diameter is more than 20 mm and yolk sac embryo are not present, or fetal pole is more than 8 mm and there is no fetal heart rate, then this is fetal demise. Prediction of early pregnancy failure. Fetal heart rate is less than 85 beats per minute if pregnancy is more than 7 weeks. Or small gestational age, sac versus embryo, like 5 mm difference between them. Enlarged yolk sac, subchorionic hemorrhage in 9% of cases, and there is increased risk for if pregnancy is less than 8 weeks of gestation. Serum pregnancy test is positive 3 days before missed period. Now the patient information. Bed rest does not prevent the miscarriage, and also stopping work does not prevent miscarriage. It depends upon the nature of work or if there is significant bleeding. If the patient is Rh negative, then there is no need for NTD in less than 12 weeks. And in conclusive scan, there are 3 main reasons of uncertainty. Too early in pregnancy, a repeat scan in 7 to 10 days. There is impending miscarriage, and probably ectopic suggest beta HCG. 3 ways to deal with pregnancy that is not progressing. These 3 ways are: number 1, wait and see approach. Second one is medical approach. And the third one is you can do the surgical approach. Thank you.